Mr. President, I would like to address the Assembly. Mr. President, one of the things we're debating right now is what is the future of the Affordable Care Act, or I should say health care in the United States. And one thing we can all agree to is that the individual market under the Affordable Care Act, or Obamacare as it's commonly called, is not doing well. I'm going to put up this Facebook post, quote from a Facebook post on my Facebook, a constituent in Louisiana named Brian. He wrote in to say, my family plan is $1,700 a month. Me, my wife, 2 children. The ACA has brought me to my knees. Now, he doesn't say this, but we know that most likely his family deductible is $13,000. I hope we can get something done. The middle class is dwindling away. Can't everyone come together and figure this out? $17,000, so his family's putting out $20,000 a year for insurance, most likely a $13,000 family deductible. They have 2 children, young family, $33,000 in health care before they see significant benefit, $33,000 of out-of-pocket expense before they would see significant benefit from their policy. Clearly, we have a problem. Next slide, please. President Trump, when he was campaigning, or candidate Trump more properly, recognized this. And he said over and over again, if you will, his contract with the voter was to maintain coverage, lower premiums, address and care for those with pre-existing conditions, and to eliminate the Obamacare mandates. And this, if you will, was his contract with the voter. Pretty good contract. I think it's something that both parties can get behind, Mr. President. Next slide. And the president, or candidate Trump, and then elected Trump, doubled down on this just before taking the oath of office, saying people covered under the law, meaning the law that he would support to replace the Affordable Care Act, can expect to have great health care. It'll be a much simplified form, much less expensive, much better. And indeed, Mr. President, the President of the United States seemed to, again, renew this commitment this past week at a lunch with 15 senators at the White House, once more saying how we have to have a law which lowers premiums and cares for those with pre-existing conditions. That's the baseline. Now, some would argue, is President Trump kind of committing himself to some right that previously did not exist, that all Americans would have health care? Well, I'm a physician, doctor, worked in a public hospital for the uninsured for so long, and I can tell you, Congress created a right to health care back when it passed the Emergency Medical Treatment and Labor Act. I think President Clinton was the one who signed it into law. And this said that anyone, whether they were a U.S. citizen or not, could come to an emergency room and receive all the care they needed, and if they could not pay, they still received the care. Mr. President, I note whenever somebody says, well, my gosh, folks don't have a right to health care. When I was in the emergency room at 2 in the morning, as long as those emergency door rooms were open, there were people coming through. They would have congestive heart failure, COPD, diabetes out of control, gunshot wounds, vomiting blood. They could be schizophrenic or a drug overdose. Mr. President, as long as that patient or those patients came through the door, we treated them. And someone paid. Now, I would say it's the fiscally conservative way that if Congress is going to say, my gosh, everybody has a right to health care, that we come up with a considered way to pay for it, as opposed to forcing the hospital to shift the cost of this care to other sources. Principally, by the way, small businesses paying higher premiums for their employees, higher rates to pay for the uninsured. The fiscally conservative way is let's address these needs. I'll also say as a physician, the kind of best business practice ways to address somebody with chronic health conditions is to actually manage the disease. If you have a diabetic who doesn't have insurance, she may come to the hospital once a month with diabetes out of control. You have to start an IV, put her in the hospital perhaps overnight, sometimes in the hospital for longer. This can cost thousands of dollars. Contrast this if you have that patient with a primary care physician and you can manage her disease. Not only is her health better, but you spend a lot less money. In fact, the wisest corporations in our country now consider the health of their employees as a cost center. What can we do to have the best outcomes at the lowest price? This is the most fiscally conservative way. And I think that is the approach that we should take as a country. Now, this kind of brings us to the next point. How do we achieve that which President Trump suggested, which was that we would maintain coverage, lower premiums, care for those with pre-existing conditions, and eliminate mandates? In a way which we can achieve this. Some folks say you cannot achieve this. I would actually disagree with this. The way to achieve it, if you will, is to actually embrace each of President Trump's goals. Susan Collins and 4 other senators and I put forward a bill called the Patient Freedom Act. And in the Patient Freedom Act, the approach we take is we first maintain the coverage that President Trump spoke of, but we do it by eliminating mandates. We give the states the options of doing something called automatic enrollment. It just means it's easy to be enrolled. Republicans have always said on our income tax, for example, that we want to make it easy to pay your taxes. Not 16 pages of forms that you have to fill out with a CPA and an attorney, but rather something that you could do on 1 page. We need to make enrollment in insurance easy. Second thing, if you can expand the enrollment, we can take from what we know works, which is on Medicare. When someone turns 65, he or she is automatically on Medicare. They don't have to fill out a bunch of forms online. Rather, they're just on Medicare. They get a card. Here's your Medicare card. You're in unless you don't want to be. If they don't want to be, we make it easy to get out. You just call up and say, I don't want to be on Medicare, and you're not. Turns out 99% of Americans like this simple approach, and they stay on Medicare. So we could expand coverage and make it simple, still eliminating mandates, by giving states the option to say to their residents, you're in unless you're out. We're going to make it simple. If you're eligible for this credit, you would get the credit, and unless you call us up and say you don't want it, you would be enrolled in an insurance program. And in this way, we care for those with pre-existing conditions. How is that the case? If you have just a few sick people in the insurance pool, then the only people that you can spread that risk among are the few and the sick in the pool. So every year they pay higher and higher premiums. On the other hand, if you can expand the risk pool to include all the young healthies, the folks that think themselves immortal, who on an average year may have only $500 or $800 worth of health care expense, if you can incorporate all of them in your risk pool, then the expense of the few and the sick is spread out over the many and the healthy. And instead of premiums rising because of one person's illness, premiums hardly budge because the cost of that care is spread over so many. We call it a risk pool for a reason. If you take a cup of water and you pour it in a large swimming pool, the level of that swimming pool does not change because that big pool absorbs the water. If you take a cup of water and you pull it in a smaller cup of water, it overflows. We need to make it whereas the former situation, where we have a big risk pool, lots of young, healthy people, that we can share that risk over the many, not the few. And in this way, we can lower premiums. It was modeled, if we did automatic enrollment in my state, still maintaining the enrollment of the older and the sicker who are already in, we would lower premiums by 20%. That's the power of giving the states the option to make it simpler for people to be enrolled in their insurance. The conservative way to approach our health care reform is to recognize President Trump's contract with the voter on the campaign trail is the pathway to achieving his goals. And as we do that in a fiscally conservative way, we recognize that we should not move this cost of care off to small businesses. We should go ahead and pay for it. It's fiscally conservative to manage these a patient's illness, as opposed to have her going to an emergency room every so often for emergency room care. And lastly, we have to say that if we kind of embrace Republican ideas of making it simpler to be in a plan as opposed to more complicated, we're more likely to have that risk pool, which is inclusive of many who are healthy, not just the few that are sick. Mr. President, I look forward to replacing the Affordable Care Act, the Unaffordable Care Act as it's become, with something which embraces conservative principles and fulfills President Trump's campaign pledges. Mr. President, I yield back.